Well, good morning, everybody. My name is Marty Mascari. I'm with the North Central Texas Area Agency on Aging and the North Central Texas Aging and Disability Resource Center, or ADRC. Both are under the umbrella of the North Central Texas Council of Governments. We are once again incredibly blessed to have our partners with Haiman+Hogue here to talk about healthcare code of conduct and ethical behavior. But before we get started, we're going to go over the CEU requirements for those of you that are joining us wanting to get CEUs. So if we could advance one slide, and Sheila Williamson with Haiman+Hogue is going to talk about the CEUs.
Good morning, everyone. If this is the first time you're joining us, or you've been here many times, then I just want to go over this quickly. We are happy to give you the CEU credit that you need if you are a nurse of any kind, which is RN, LVN, anything, okay? If you are an LPC of any kind, which is LCDC, and there's several levels of LPC, I found that out recently. So any of those, we're good with that. And social worker, there's several levels of social worker, any of those. And then assisted living managers, which I still don't see any of, and I wish they would join us because there's a lot of programs we have that are good for them, training that we have. We do this because education is our primary core value at Haiman+Hogue. So we are here strictly to educate you. Here's what you will do. You will receive from Marty later 2 forms, which are, well, 3 forms, but you're used to these, an eval and a sign-in sheet, and as well as a disclaimer, because telling you that we do this for a living. So please understand that we are here only to educate, not to sell anything. So, but please return those 2 forms to me, okay, which is Sheila Williamson at Haiman+Hogue, which is your sign-in sheet and your eval form, and then I will be happy to send you your certificate.
And while Sheila was telling you that, I noticed the typos that I made in the slide. They all really are October, not some from September and some from October. So if you look at the dates, I changed the day and not the month on 2 of those forms. So we'll get those forms out to you. But in addition to the information that you'll need to provide to Sheila if you want to get CEUs. And I do have a real quick question, Sheila. Are those CEUs, when we do CEUs, we're set up in Texas. Now, other people can apply for them and they can use them, but we don't have any authority. Are you set up just for Texas, or is okay.
I don't think so. I think it is good for anybody. Okay.
I just didn't know. When we do ours, we're just set up for Texas. Although I have people outside of Texas that go through the process. I've heard that they use them, but again, in our case, we don't have any jurisdiction outside of Texas. But you will also see a Google survey link. It should pop up when you close out of Zoom today, but if not, you'll receive that as well in the follow-up email. We're asking you to fill out the Google survey. That helps us with reporting back on our objectives we set forth when we applied for funding to do these webinars. So if you could fill that out as well, we'd certainly appreciate it. So Sheila, I'm going to turn it over to you and let you introduce Fred, if you would, and we'll get going.
Well, good morning again, everyone. I'm very happy to introduce my boss, Fred. He is going to talk to you about ethics. Like I say, it is sad that we have to teach this, but there are things that people are still doing, which you're going to hear at the end, that should be common sense to the most of us, but they're not, apparently, to everyone. So anyway, Fred is the founding partner of Haiman+Hogue, and he, like you said earlier, if you were on here, he was a police officer before he was an attorney. So he has experience in both realms. So no, I'm sorry, I'm answering one of the chats and I shouldn't do that yet. So anyway, anyway, without any further ado, Fred Haiman.
Well, I think, Sheila, you pulled a squirrel right there for a minute. My youngest daughter does that all the time, which changes gears in the middle of a talk. So, yes, my name is Fred Haiman. I am an attorney, and please don't hold that against me because I probably hate attorneys more than you all do. because I have to work with them. And I have worked with them for over 25 years. Prior to going to law school at Texas Tech, I saw we have some Lubbock people out there. I spent some years at Texas Tech. But prior to going to law school, I was a police officer out in El Paso, Texas for over 5 years. Worked a variety of things, but one of the assignments I had after I completed my master's degree, because I worked to UTEP and got my master's while I was a police officer. And when I completed that, they moved me up to the chief's office, and I worked in research and planning and special projects and other areas with the chief of police, and was in the heart of this code of ethics type of behavior issues and dealing with that for the police department. Then my first job out of law school, I was hired. I call El Paso the black hole because I've left 3 times, and 3 times it sucked me back in. Because after law school, I was living in Austin and got a job offer to go back to El Paso and be an attorney for an organization called CLEAT. CLEAT is the Combined Law Enforcement Associations of Texas, and they provide legal representation for law enforcement and detention officers of all sorts. I became the staff attorney for all of West Texas, so it was pretty much Midland, Odessa, West. And I represented officers on many ethical issues. So I am going to talk to you a little bit about the specific ethical codes of conduct for social workers and nurses, which really apply to anybody in the healthcare area. But I'm also going to talk about ethics in general and what that means and how it comes into play in our workforce. So nursing ethics are the central moral values, duties, commitments of nurses. So basically, we all know that the ethics issue is revolved around what is your moral responsibility to your job? What is your ethical responsibility to your job? One of the things I've always said in my life is that there's a lot of things that can be taken away from us, but the only thing that we can give away is our integrity. And so integrity is such an important aspect of a professional, our professional lives, whatever we do. But if we are licensed in any way, we are governed by the licensing authorities. So when I was a police officer, we fell under the TCLOS, Texas Combined Law Enforcement Agency. I can't remember the acronym, but TCLOS was the licensing agency for law enforcement officers. They're the ones that gave us our license to be a police officer and oversaw all training and the requirements of police academies. Nurses have the same exact type of thing. Social workers have the same type of thing. All medical professionals and professionals that are licensed have to deal with this. We're going to first talk in specifics about nursing. Nursing is covered by the Texas Occupational Code, called the Nurse Practicing Act, and it sets up and creates the Texas Board of Nursing. That is the overseeing governing authority over nurses. You all will get all of these slides, so a lot of these I'm not going to go to in great detail, but you'll at least have them so that you can look back over them if you want. But the Texas Administrative Code determines what licensure is, what peer assistance is, what minimum acceptance level standards for nursing is. It does set up the Board of Nursing, and it says that the board is responsible to ensure safe nursing practices are followed. It is set up, the mission of it is to protect and promote the welfare of the people of Texas. And that is pretty much every agency that oversees anybody with a license. Is we know that there are good and there are bad, but most licensing occupations are they're policed by themselves. And so the Board of Nursing is responsible to look at nurses, and you know there's the medical profession looking over doctors. But their whole emphasis is to ensure the welfare of the common person, to make sure people in that field are competent and they provide safe practices. They look over regulation, they look over licensing, they approve issues, and the mission supersedes the interest of any individual within the occupation. Training, there's certain trainings that must be done You must comply with the ethical policies dealt with by the Texas Ethics Commission. The Texas Ethics Commission has a statutory duty under the government code, and its policy is to legislate, put forth legislation to protect the constitutional privileges of free suffrage by regulating elections, blah, blah, blah. It's all basically saying that this ethics commission is to set up training for various different occupations to make sure that they are compliant with ethical rules of our government. A license holder, this is really a weird one to me for nursing occupation. A license holder shall complete at least 2 hours of continuing education relating to nursing jurisprudence and nursing ethics before the end of every third 2-year licensing period. That is very confusing to me and hard to follow. I don't understand why it is that complicated for nurses. In the law field, I have to have 3 hours of ethics every single year. So not only do we have to have 15 hours of education in general, we have to have 3 hours every single year. So one of the things that most of you all are probably already aware of, but you have to be aware of if you're new in an occupation, is how many hours of ethics do you need and when do you need them? Because if you don't get them in time, it can jeopardize your license and affect your license. Other important statutes that deal with nurses are the Texas Occupational Code that deals with nursing peer reviews, the licensing of nurses, and the consequences of criminal convictions. The criminal convictions aspect falls under the Texas Department of Public Safety and is governed by the Texas Government Code. So we have all these different codes within Texas, all these different statutes. And if you ever can't sleep at night, find one and try to read it. Because they're ultra complicated, they're hard to keep up with, they're hard to follow. You have to look into many, many areas. That's one of the things about that you learn in law school and part of being a lawyer is that not anything that you're wanting to find out is in one place. You have to look in several different areas to be able to cover whatever you're usually looking at. So the Texas Government Code, Chapter 411, deals with access to criminal history records that the Board of Nursing can have. So can the Board of Nursing pull your criminal record or look into your criminal record? The answer is yes. They can look into it, especially if you're filing for an application. So if you are in the application process, they can pull it to determine your eligibility for whether or not you should get a license or not. And they can pull it anytime there's a complaint or a formal charge against you. So if there is issues that come up dealing with complaints, they can pull criminal records and they can use criminal records that have nothing to do with the complaint to decide whether or not you keep your license or not. So in essence, you have to keep your nose clean both on the job and off the job, or it could jeopardize your license. The Texas Administration Code deals with the definition of unprofessional conduct. Unprofessional or dishonorable behavior of a nurse that the board believes are likely to deceive, defraud, or injure clients or the public. Now, how vague is that definition? That definition is about as vague as it can get, which means that it gives the board unlimited power. And so a lot of these laws are written to give the overseeing agency or the overseeing board over an occupation extreme discretion over what they determine to be unprofessional or dishonorable behavior, what they believe to be deceiving, what they believe to defraud or injure clients, or the public in general. It is these boards have a lot of power. I worked for a firm in El Paso for about 6 years, and one of my fellow attorneys represented numerous nurses in issues against the board. She was a former nurse who went to law school. And so she dealt with a lot of these issues dealing with ethical complaints against nurses. So the American Nurse Association, which is really a national organization, they established a code of ethics in 1950. Code of ethics is not set in stone rules, but more guidelines on how you're supposed to behave. So as it says, the Code of Ethics for Nurses was developed as a guide for carrying out nursing responsibilities. let's talk a little bit about the Texas Board of Social Workers and what they have to go through. They're, again, a lot of their rules come from the Texas Administrative Code. The Code of Conduct says a licensed social worker must observe and comply with the Code of Conduct and the standards of practice. Any violation of either one will constitute unethical conduct or conduct that discredits or tends to discredit the profession. Again, it's a very broad, ambiguous kind of definition that gives a lot of discretion to the board that oversees social workers. Mainly, it deals with issues. You can't discriminate. You shall give your credentials and qualifications. That's why almost every place you go in the medical field, people are wearing name tags. Those name tags, one of the requirements for that name tag is to give credentials and qualifications to anybody they come in contact with. They can only provide services within their professional competency, and this doesn't mean within your social work. I'm a social worker, so I can do anything that a social worker can do. No, that means that you need to be within the area of expertise maybe that you have trained in. Every occupation is becoming this. The law has become, I guess I would say that the medical profession, doctors, we're probably the starting point of specialized fields. You know, I don't go to a foot doctor to have my brain looked at. I don't go to an eye doctor to deal with my heart. There are professions that are narrow in their scope. The same thing has happened to the legal field. For instance, all I do now, the only thing that my firm deals with is estate planning and elder law issues. We don't do divorces. We don't do criminal defense. I don't do anything outside of that area. I've had people call me, can you help me with my bankruptcy? No, I cannot, because I have no idea what to do in bankruptcy. Social work and nursing has become that way too. Not quite to the extent, but you have to remember you cannot work outside of your area if you've not been trained in that area. You shall maintain and improve professional knowledge and skills in general, and that's why they require you to have the CEU credits. Your services should be based on assessment, evaluation, and diagnosis of a client. You shall safeguard the client's rights, maintain professional boundaries, not have sexual contact with a client. It always surprises me that has to be put in writing, but you all have heard stories after stories after stories of people in occupations getting into sexual relationships, whether it be consensual or non-consensual, with clients. It happens in our schools. It happens in every area of life. And therefore, we have to have it in writing. You must refrain from providing services while impaired. Okay, you can't show up to work drunk. You can't show up to work high. And you can't show up to work if there's any mental health or mental condition that you're dealing with. And that includes prescription medications. So if you are taking prescriptions that impair your thought process or your ability to do things, that can be a reason for a discipline and or loss of license. Shall not exploit your position, shall not evaluate, you shall evaluate a client's progress as you go and keep that client informed. You shall refer to the client for those services, or refer a client to those services you're unable to give. So for instance, if you are working in a social work area with elder care area, let's say geriatrics, and you come across somebody that has maybe a drug or alcohol issue, and you're not trained in that area, you are to refer that client to someone who is a professional in that area. And that's where I have seen people get in trouble, is and quite often they get in trouble not out of bad conduct, but out of, I want to help somebody. I really feel bad. I feel an obligation, and I really like this person, so I want to help them. And they help them in areas they shouldn't help them with, rather than provide them assistance by somebody that should. I see it with attorneys all the time. In the estate planning area that I work in, I get people that come into my office with horrible, horrible documents. And then I find out, where did you get those documents done? And they said, oh, a friend of mine's divorce lawyer said he would help me. Well, he shouldn't have been doing it, because that's outside of his expertise, and he should not have been helping this person. And he probably helped him, maybe he wanted to make the money, but maybe he just wanted to help somebody, but it can cause problems. So the National Association of Social Workers has set up a code of ethics. And again, the code is a guidebook. It is not a rule, hard rule and regulation, but it's a guide to help social workers know that they should help people in need. They should address social problems. They should challenge social injustice. They should respect the dignity and worth of every person they deal with. They should recognize the importance of human relationships. They should be trustworthy. They should work in their areas of competence and professional expertise. As you can see, this list right here is extremely broad. And it's really what does all that mean? And if somebody asks me specifically, what do I feel all those mean? I don't know. What exactly does it mean to challenge social injustice? What does it mean to recognize the importance of human relationships? I mean, we all can say, yeah, I kind of understand what that means, but it's some of these areas are, yeah, I know what it means, but I can't put my finger on it exactly to give you a definition of what it means. And I think they do that on purpose. They do these rules so that there is some broad meaning to them. So certain ethical standards that social workers have to keep up with. They have to have a commitment to their clients. They're responsible for promoting the well-being of their clients. Self-determination. They must respect and promote the right of their clients. Self-determination means that they need to give their clients a say-so in things. You can't just make decisions for your clients without them having some input into it. We deal with that all the time. Informed consent. The person has to say they're okay with it. And informed consent can become a gray area, because does this person have the mental capacity to give consent? Does this person have the age to give consent? Because we all know that under the age of 18 in Texas, you are a minor, and minors are considered incompetent to make decisions, and they cannot enter into contracts, etc. So a minor cannot legally give consent. And I've seen people get into some issues with this. And again, competence. You must be trained and licensed and supervised experience in the area that you work in. Cultural awareness and social diversity. This is a big issue right now. Of course, we've got a big issue between races and national origins and genders and all discrimination issues. You must be aware of the people that you're dealing with and not offend them. Every culture is different, and every culture has things they do differently. And I'll tell you a situation that I got into when I was a police officer. I was called to a family fight. I get to this house. I can hear things going on in the house. I knock on the door. I was by myself. I hadn't gotten backup yet. And I could hear a fight going on in the house. I knock on the door. A person answers the door. They were of Asian heritage. And I'm trying to talk to them. And I see in the background 2 people fighting. And I barged through and went in to break up the fight and started a bigger fight. And the thing got completely out of control because I intruded into their world. And when everything finally got under control and calmed down later, one of the biggest complaints that they had was that I barged into their house with my shoes on. Wouldn't even thought twice. I was, a police officer trying to do my job, but because of their culture, I offended them by doing that, and I made the situation worse instead of making it better. You cannot engage in any conflicts of interest. That's a big issue in every occupation. We see that every day in the legal field. We have to make sure that we're representing people that haven't been represented by somebody else, or we're talking to somebody that's had representation by somebody else. But conflicts of interest is a big issue. And of course, we all know privacy and confidentiality. This includes things that we all are guilty of. And I'm going to admit myself, because we all like to go home and talk to our families about what our job is. And sometimes we don't think that when we're talking to our families, we might be breaching confidentiality and privacy issues in talking to them. Now, usually it's not an issue because it stays within the family and it doesn't get out, but it can, and it can cause problems. I've seen it in divorce cases where a person, trying to get back at somebody else, tries to affect their license by disclosing that they came home and talked about things they shouldn't have talked about. Access to records. Your clients have to have access to their records. You can't hide your records, any records from the client. And of course, we've talked about this already with the nurses. You can't have sexual relations with your clients, either when they're your client or after they're your client. There are big issues and big problems that people get into. I used to say when I was a police officer and when I represented police officers, if it wasn't for alcohol and sexual relations, I wouldn't have a job, because those are the two issues that got police officers in more problems than anything I ever saw, were those two areas. Physical contact. This is one that gets people in trouble even when they don't mean to. And that's physical contact in general, not sexual contact or not sexual harassment, but just touching, hugging. I've had people get complained on because they got hugged by somebody, and you know that the person that hugged them didn't mean anything. It wasn't an inappropriate hug, but you know, there's certain people, and I'm one of them. I'm a hugger. I hug my friends. That's something that I do. And when we're in our work environment, we have to really watch that, because I've had complaints of somebody putting their hand on somebody's shoulder, and it was completely innocent, but it was offended by the person that got touched. And so any physical contact whatsoever with clients needs to be watched out and watched over. Sexual harassment, we all know that. Sexual harassment is a big issue, dealing with sexual jokes, sexual comments, requests for sexual favors, anything verbal, written, electronic, or physical in nature. I had a case when I was in El Paso where I represented a lady that was an employee of a bank, and she wanted to file a lawsuit against the bank because she was fired for filing a complaint against a manager, a female manager, who would come in and in graphic detail explain her sexual exploits outside of work. And this lady who worked at the bank was offended by it. We filed a sexual harassment lawsuit, and long story short, that lawsuit got poured out and got dismissed because this manager, although her behavior was inappropriate, did not at that time meet the requirements of the legal requirement of sexual harassment. And the reason it didn't is because she was an equal opportunity sexual harasser. In essence, what she would do is she would come into the bank and talk about her sexual exploits to everybody, both men and women. And at that time, the law said sexual harassment was gender specific. So if she just told it to the women or she just told it to the men, that would have kept my case alive. But the fact that she told it to both genders made it inappropriate, but not illegal. What the bank did to her, I don't know. But the lawsuit was dropped by the court because of that. I couldn't believe it. It kind of caught me off guard as the lawyer, but I never dreamed about that. But sexual harassment is a big, big issue that needs to be watched all the time. Watch what you say, watch what you do. Even if you don't mean it in a sexual way, it can be taken wrong. Derogatory language, that's just bad language in general. I think we're in a society right now that the F-bomb is almost becoming a common word, because that's every song that my daughters listen to have it in it. But you got to watch the things you say at work and whether that will be offended. I hope that word doesn't ever become part of our regular vocabulary, but some words have. And I mean, we've got words now that can be used on radio and TV that 20 years ago could not be used. And so again, the times kind of determine what derogatory language is, but you need to be aware of what you're saying around fellow coworkers and clients. Payments of services that need to be fair, of course. You can't gouge clients, etc. Clients who lack decision-making capacity, you need to make the safety reasonable safeguards to protect those people. And any interruptions in services, you must make reasonable efforts to make sure a person is taken care of. Where this comes into play is when you want to fire a client. And we get that all the time, especially in the litigation area of law, where the client's not being cooperative and you want to get out. They're not paying you, whatever the case may be. In our field, in the legal litigation field, quite often the judge oversees this, and he will only let an attorney withdraw if it won't jeopardize the client, and the client can get another attorney before anything. I have had cases where I wanted to withdraw, and the judge wouldn't let me because we had a hearing set in 2 weeks, and the judge says, you've got to represent this client until the hearing is done, and then you can withdraw. And I had to basically work for free because the client wasn't paying their bill. Referral for services. We've talked a little bit about this already, but you must refer clients to other services if it's not within your expertise. And there's a big, long definition of terminating services and how you go about doing that. And in the gist of it is you can't terminate services if it's going to hurt the client. You've got to make sure, again, the safeguards that the client can be taken care of by somebody else, et cetera. You can't just quit. Additional ethical standards are governed in some of the other sections of the Code of Ethics. I'm not going to go over them in detail. A lot of them overlap, but the ethical responsibility to colleagues, to practice settings, to professionals, to other social work, the social work profession, and to the broader society in general. So at this point in the presentation, we usually talk about some ethical case studies. There's one of the biggest ones I see quite often, and I don't know if these were sent out to you, this list that I've got on the screen right now, but we're going to talk in general, and then I'm going to kind of open it up. Let me go back to that. I'm going to kind of open it up to anybody that wants to share issues that they are dealing with themselves. Ethical issues pop up. It's one of those areas that, yeah, Sheila touched on it, and I've joked about, why should we even have to teach people how to be ethical? But the reality is everybody does things wrong. We have bad apples in every single occupation, and the people that are trying to do things right need to watch out for that and need to report it and need to keep our occupations honest. But there are certain things that come into play that you find yourself in a dilemma. And it's not just an ethical right or wrong, but it's okay, what am I supposed to do in this situation? And one of the case studies we talked about was a staffing issue that resulted in a brain damaged patient. And staffing issues, I think, is a huge problem in the medical field because we're so short-staffed. There is not a hospital, I think, that has the capacity of nurses that they need. I don't think there's enough social workers out there. And why is that? One is the pay. The pay for this field is not nearly what it's supposed to be. The workload is extremely demanding. It's very stressful. The turnover in certain areas is very high. And so you have these issues of staffing, and what are you supposed to do? So one of the case studies we've talked about in the past is a person that goes into work and they know that they are short-staffed. They know that they have way too many patients to watch over than they should be. And it's way outside of the parameters that are even in the guidebooks of the medical facility. What is that person supposed to do? Is that person supposed to go to their job? And if they go to their job and something goes wrong, who's responsible for that? Is the nurse responsible? Is the medical facility responsible? Is the doctor responsible? Whose fault is it if something goes wrong? And I think that a lot of you all have probably had that situation happen. Some worse than others. Some it's, a minor thing happens, but sometimes there's major things that happen. To give you a little bit of my background, I was a trial attorney for the first 10 years of my life. And I was working 60, 80 hours a week, and I was in very high stress litigation. I got diagnosed with a disease that all of y'all probably are familiar with called ulcerative colitis. My ulcerative colitis over a 5-year period got worse and worse and worse. At that point in the early 2000s, they didn't have some of the medications on the market they do today. So most of my symptoms were controlled by prednisone. And so I would get on high levels of prednisone, I would taper down, and then it would hit me again. And I'd back and forth for 5 years. At the end of 5 years, the doctors came to me and said, we either remove your colon or you're going to have colon cancer. I was only 42 years of age. And I'm not ashamed to say at that point in my life, I was a very arrogant, a matter of fact, trial lawyer. And my only concern at that point was, how long am I going to be off work? And they told me minimum of 3 months. I, of course, told myself I'd be back in 6 weeks. And if you ever want to make God laugh, tell him your plans, because God had different plans. My intestines, the doctors messed up my operation. My intestines ruptured. I was in critical condition for 10 days. I was in the hospital for 37 days the first time. I was in and out of the hospital numerous times, out of work over 8 months. Ended up having 6 surgeries, including the last 2 up at the Cleveland Clinic in Cleveland, Ohio, to put me back together and save my life. During that time period, I learned how really difficult the nursing field is, because I was suffering through issues that I was dealing with, but I also observed that there is a severe shortage of nurses. And my family learned that they had to have somebody with me at my worst, when I was at my worst points. They had to have somebody with me 24 hours a day to make sure that I was taken care of, because there were times where there were nurses responsible for 17 different rooms on the floor that I was on. There was just overwhelming shortage of staffing. And things go wrong all the time because of that. And so where's the ethical issue with that? Who's that fall on? Do you call it to the attention and say, hey, this is so overwhelming that I'm not coming into work. I'm not going to put myself in a position of possibly losing my license because you're putting me in a position of having to do work that no person can reasonably do? Or do you do the job and take a chance? So these kind of ethical issues are very, very common, and there's not an easy answer to it. So that's part of why we do these ethical trainings, is because not everything is ethical in the just right and wrong. Some of it, there's not just a right and wrong aspect to it. So I'd be curious to find out if there's anybody out there that would like to share a situation that they've dealt with, in that poor staffing resulting in a problem, and how you dealt with it, or how the administration dealt with it, and what were the consequences of it. So Sheila is monitoring that. If anybody would like to raise their hand or put in the chat you'd like to talk, I think Marty, I'm not sure if there's a way for us to unmute somebody so that they can share that with us.
We
the best way to do
that. We'll try that. I haven't tried it on these formats just because we have so many people on, but why don't, go ahead and raise your hand and we'll try that, if you'd like to.
The first time we did this training, I will tell you, there were experienced nurses in the group and there were young nurses in the group. And Fred did exactly what he just told you. And one of the nurses said, this whole table of young nurses was nodding because they face this all the time. And it doesn't matter where they were working. It's just, that's a common thing apparently. And then this other nurse who had been for 25 years said, no, you just absolutely refuse to go in because it's your license on the line. And this table said, we can't do that because they'll fire us. They'll let us go. And she said, well, then you're working for the wrong people because you're jeopardizing your own license. And so that's when Fred and I learned there is no easy answer for this. Mm-hmm. So I don't know what we came up with that night. The 2 groups worked it out, where the experienced nurse suggested that you contact the person that his shift is ending and ask them to stay a couple more hours. Then you contact the person that follows you and ask them to come in 2 or 3 hours earlier. And that way, that could be helpful. So it's kind of like a compromise. But
Well,
you're,
and a lot of that comes into play of your bosses and your
I know.
administration and approving overtime. And so there's many complications that come in that. But while we're waiting to see if somebody would like to share, I do want to go on to the second one, the patient suicide attempt. We had an issue at one time. There was a case study one time we talked about where a social worker was working with somebody, and that social worker did not have specialized training in suicide prevention. They did a lot of other areas in the social worker area, but they did not have training specifically in the area of suicide and suicide prevention. But they had a patient that was suicidal and was showing suicidal tendencies, was showing issues of possibly being a danger to themselves or others. And they continued to help that patient and work with that patient. And the patient eventually attempted suicide. That social worker, because of the fact that they did not refer that patient to somebody that was trained and had more expertise in suicide prevention, their license was in jeopardy for them working outside of their expertise area. And so that's where that comes into play quite often. And if I was to guess, I would think that that social worker did not want to do anything wrong, did not intentionally do something unethical. They cared about this person. They wanted to help them, but yet they ended up not helping them because they didn't get them somebody else that could have been better and better dealt with it than they could have. Now, of course, the question comes in, even if you would have provided them with an alternative and sent them to somebody that was more trained, would that have prevented the suicide attempt? Well, nobody can answer that question. But the reality is you've got to try. And so that's where referring and knowing your limitations is. We get it all the time where, sometimes it's a life and death issue for people in the medical field. And that's where it really becomes an issue. I deal with it in the legal field all the time. I'll get friends or family or somebody that say, hey, I really can't afford to hire an attorney to do this. Can you just help me do it? And at the beginning of my career, I'll be honest, I took some cases I shouldn't have taken because I didn't know what I was doing. I knew the law in general, but I didn't know what I was doing in that area. And I almost got myself in trouble a few times because I was just outside of my expertise. I don't do that anymore. Maturity and experience sometimes helps in life. And so if people call me with any issue that is outside of my area, I won't even talk to them about it. And they're like, oh, come on, you got to help me. No, I'm sorry. That is not what I do. And I would be doing you a disservice if I tried to help you. And so we all need to have that kind of mindset of you're doing a disservice if you help somebody outside of your area.
Okay,
Teresa has raised her hand.
Yeah, Teresa.
Teresa, yeah. If you will, if it looks like you've unmuted yourself, you can go ahead and share. I think.
So what I've learned in my 30 years of social work is nurses have a parlay system, if I'm saying it right, and if there's a nurse on here, correct me, that they can call in an unsafe environment where they are being overworked or abused with work, and they can create a safety net. Oh, there you go, safe harbor. Thank you. Where they can call in and report the situation to protect their licenses. If a nurse does not show up for work without calling in, for whatever reason, of course, they can remand her license for abandonment of care. So you have to, as a nurse, you have to be very careful. As to social workers, I have never met a situation that warranted me reporting to the state an unsafe situation. I worked for an agency recently that I was working 14-hour days because they would not hire anybody to assist in the care that I do and the planning I do with my guests. And I had to resign from my own mental and physical health and well-being, because that company as a whole will use you until you're burnt out. And they look for people with strong ethics. I couldn't leave in the middle of helping a family because I had been there 10 hours already. And you have to be able to look inward first, because you do need to walk away. I gave notice. They had the opportunity to hire somebody, and they did. And I hope that social worker is doing well in that position. But I knew that I was not providing the best care I could, and in that situation where they were working me through and through. So you have to, some people are leaving messages, but the nurses do have an opportunity to protect their licenses when they're being abused by overwork or too many guests or whatever, because they are life and death more so than a social worker would be. Misdiagnosing or mismedicating somebody is a lot more critical, in my opinion. I've been a social worker for 30 years. So the goal is to make sure that the patient's care is the best. And if you can only do so much, you need to be sure you let people know you can only do so much.
Well, one of the things areas where I see social workers have this dilemma of staffing is not so much their staffing as they're responsible for watching over the staffing of others. For instance, my 90-year-old mom is in a skilled nursing facility, and that skilled nursing facility is constantly shorthanded with nurses and CNAs. And there's a social worker on site, and I had situations where the social workers were saying, well, at what point do we report that there is a shortage of other professions that, you know, I'm kind of the social worker of a facility like that, kind of oversees the whole facility. At what point are they responsible to report staff shortages that might jeopardize patient care, et cetera? So that's where I've seen a social worker issue in the past. One of the questions I saw come in was, you know, at what point is it neglect if you don't go to work because of it? I don't know the answer to that, because that is a huge ethical dilemma. Am I neglecting my patients by not going in? Or at the same time, am I jeopardizing me and my license if I do go in? Or am I jeopardizing my job if I don't go in? So there's a number of things that come into play in those situations, and there's not, unfortunately, an easy answer to
I
that.
like this question though, Fred. As a dialysis social worker, our max caseload is 125 people. Wow, that's a lot.
That
But
is.
if we get over 130, the company will pay us a bonus. Working over census, but being financially compensated. Could that be an ethical issue where a license could be jeopardized?
Oh, most definitely. Most definitely. Yes. It could be an issue with both the licensing issue, but it's also with the company that's has that incentive. So in essence, they're giving a financial incentive for you to violate the rules. And that's a big problem. Yes.
But again, it takes the national boards and people willing to speak up to the lawmakers, because a licensed skilled nursing facility that has 120 beds is required to have one full-time social worker, whereas they could have 100 beds and they're not required to have one full-time social worker.
Oh,
So
wow.
the facilities are able to manipulate and push that social worker to their ends,
Mhm.
and they're paying minimal. They're paying minimal money for these social workers to be able to work, and then in order to keep up to your obligations, you're basically letting them abuse you.
Yes. The facility that my mom is at, I've had her there 6-9 months. I guess I had to move her at one point from another facility that was not doing what they should. But I think in the time that she's been there, I think I've seen 4 social workers so far. So the turnover is astounding in those type of areas. Yes, it's terrible.
Okay, here's a good one. I was recently hospitalized for a surgery and subsequent rehab stay. Circumstances led me to feel unsafe in the hospital. I asked for a transfer and was denied. Who can I complain to and start an assessment of possible violations of my rights as a patient? The hospital created a mental health crisis for me. I asked for my medical records to be sent to my primary care physician, but continuity of care was not done. I wanted to fill out forms and take the medical records to ensure that the records were sent. Ultimately, I had to ask physician to request the records, and he received inadequate records from them. I had to schedule a telemed visit at my expense to provide information necessary to control my hypertension since the dosage had changed during admission. This was only one instance of possible violation during my hospital stay. I want to ensure that this situation does not occur for other patients. How do I start an investigation for possible hospital violations in Missouri?
I don't know the answer to that. If somebody on the call on this has some suggestions, please give them to her, but I don't have an answer to that one. I don't know who exactly in Missouri would be the agency that would take those type of complaints. No idea.
In most hospital settings, there's a request for information you have to fill out completely to be able to request your chart. On those documents, you indicate which records you want, and the hospitals and healthcare centers have up to 90 days to provide those documents. JCO oversees hospitals and the state oversees nursing care facilities, and that's where you would file grievances.
So for those that don't know, what does JCO stand for?
That's a Joint Commission of Accredited Hospitals, I believe. I'd have to really Google it. Working in a hospital, we just knew when JCO was there. They are the people who oversee all the care and all the requirements to provide care in a hospital setting.
And is that Texas specific?
No, it's national.
Okay.
It's now called TJC, the Joint Commission. Thank you, Maeve.
Thank
Maeve.
you.
Okay, let me talk about one more issue before we start wrapping this up, and that's with the medical directive issue. And I get this question all the time because this is really my area that I deal with in doing estate planning documents and all for people. One of the big issues that we have in the advanced medical directive ethical dilemma is what exactly is an advanced medical directive and how is that different than a do not resuscitate or DNR? And how do we tell the difference? And really, who has the say so when it comes down to it as to whether these documents are honored or not? So for those of y'all that aren't familiar, I'm sure pretty much everybody is. An advanced medical directive, or what is also called a directive to physicians, or what used to be called and may still be in some states called a living will, is a document that in essence says, if something happens to me, I want doctors and medical professionals to do everything in their power to help me. I want them to do everything in their power to make me well. But if all else fails and everything has been tried and there is no longer hope, and now the only decision is keep me alive on a machine, life support, or let me go, then the advanced medical directive is where I've said, while I was well, what I want. So I've said, either keep me alive on life support or let me go and let me die naturally and keep me comfortable while I do. So the advanced medical directive is really very different than a DNR, because a true DNR, if it's done properly, and again, these documents are only as good as how they're drafted. And so some states have generic forms. I know in Texas, we have an out of hospital DNR, but the reality is that out of hospital DNR, depending on how it's filled out, can be either an advanced directive or it can be a DNR. I don't like those forms because unless you know what you're doing when you're filling them out, you're going to mess it up and something's going to go wrong. But a true DNR is a document that basically says, don't touch me. Don't touch me, period. Don't touch me to save me. Don't touch me to make me well. Don't touch me to do anything to me. Just let me die. And so when I get people that come into me all the time, everybody's heard the saying, oh, you need to have a will. Everybody needs to have a will. I get that all the time. And oh, everybody needs to have a DNR. And I have to tell people, no, most people I don't do DNRs for. I really do very few DNRs. I do them for people that are already dying, people that are on hospice, people that have been fighting cancer or other issues, and they no longer want to fight. My mom, because of her age and because of her health and declining health, she wants a DNR. She is at the point, she's 90 years old, she'll be 91 in January, and she doesn't want anything done if something happens. So I always have to talk people through that, but it becomes a medical issue and an ethical issue because sometimes those documents aren't clear. Sometimes the hospitals feel that they can overstep those documents, and they can say, well, yeah, this person says they want to be off of life support, but we don't want to take them off life support. So we've had those issues come up, and everybody has a right to move their loved one to a different medical facility if the medical facility is not doing what they believe they want. And I've had issues like that where a person was at a hospital, I think it was down in Houston, and the hospital was refusing to honor the person's wishes to be taken off life support. So the family moved that person to another hospital who carried out the wishes that they wanted. You know, I had with my mom a personal issue. She has a DNR, and I moved her from the facility she was in to where she is now because she almost choked to death. She is supposed to have her food cut up really, really small because she has swallowing issues. She has chewing issues. And they unfortunately fed her a pork chop, and she swallowed a piece about the size of a 50-cent piece. And it choked her, but not completely. They took her to the hospital. The hospital called me and said, your mom is breathing through a straw when she should be breathing through a garden hose, and she has refused intubation. And if she becomes unconscious, you now have the choice. You because you're her medical power of attorney, and you get to decide. And I said, there's no decision. My mom has already decided, and as much as I don't like that, she has decided she doesn't want intervention. Then even if she becomes unconscious, she's not going to get it. So the doctor was like, okay, fine. Luckily, later that afternoon, they were able to suction her throat, and they got the piece of meat out and saved her life. She consented because she was still conscious enough to let them do that, but she could have refused that. So the DNR advanced directive dilemma, ethical dilemma, comes up all the time in the medical profession and in our legal profession. Those kind of overlap. I see a thing that's come in. A DNR is for a specific instance or person being found with no heartbeat and is not breathing. Where's that? I lost it.
And it's when a person's heart stops and they states no CPR, placed on a vent, or cardiac meds. Does not mean that they does not. Well.
So again,
Yeah,
depending on how the document is written, if it's a true advanced medical directive and it's written properly, if a person's heart stops and they can shock it or do CPR to bring them back, they will. Because an advanced directive, a true advanced medical directive, doesn't say don't try any life-saving techniques. Don't only prevent life-sustaining techniques. So that, again, there's the issue between a do not resuscitate order and an advanced directive. A do not resuscitate order says don't save me, don't shock my heart, don't give me CPR. If something like this happens, don't do anything. An advanced medical director says, yes, do everything to save me, to bring me back, to whatever. Just don't keep me alive after there's no hope. And again, I get the calls from families all the time saying, you know, they're keeping my dad alive on life support. He did an advanced directive saying he doesn't want that. And I have to explain to the family, well, that's because the medical profession still has overwhelming authority to decide when there's no hope. That document doesn't kick in until there's no hope. If they're keeping him alive on life support because there's hope, that the medical profession is saying there's hope, that he could get well, they're allowed to do that. And so again, this is a very, very gray area at times, and it becomes an issue. And that's probably the most complicated issues I deal with in the legal area is, what do these documents say? What do they mean? And that's why it is so, so important that people go to somebody and have documents drafted properly. Don't do it on the internet. Don't have somebody do it that doesn't do this for a living. Have these documents done by somebody that knows what they're doing, because they are only as good as how well they're written.
Also, at the last one of these, it's talking about how one of the ethical case studies is how you acquire information about a client in an odd way. In other words, not you're asking them, it's just somehow it comes out in the conversation, or comes out in a way that you should not have this information. I will tell you a personal experience that I had is several years ago when my son was in a hospital, a major hospital here in the North Texas area. I was coming down from visiting him, and it was a very stressful time. I was coming down in the elevator, and there were two nurses in the elevator, and they were not young. I mean, they were experienced nurses, and they were laughing and talking about a family. And I overheard several, because it was quite a lengthy elevator ride. And I remember thinking to myself, that's horrible. Because number one, they didn't know, but what I was a family friend of that family. Okay. And number two, just like in our case, in the legal field, that was one of the things he told me early on when he hired me, is that I can't discuss any client with anybody. And so even at a networking thing or whatever, I can't thank you for doing business with us. I can't I can't do any of that, because that is confidential information. We don't share that. And I will tell you, regardless whether you are in a hospital, whether you are in a rehab, whether you are in a senior living facility or early child, anything like that, please make certain that your employees know that. Because did I report those? No, I did not report those nurses. I probably should have, but I just felt like it was just so bad. I couldn't believe they were laughing about the family. Now, I am certain, believe me, I am certain that there are people that when you treat them, of course, that's going to come up. You're going to say, oh my gosh, these people, I mean, of course, to yourself. But please don't be doing that outside. Yes.
Hey, Sheila, we're running out of time, so I'm gonna.
Honey, we have till 11:30. You know this. This last 11:30. Yes.
No, I thought we had till 11. Okay.
No.
One of the questions I saw was, do I have a form of a good one? No, I don't. I don't provide forms to people because I don't want them filling it out on their own. And every time we do them, we custom do them to every client that we do. Now, yes, there's a template form we use. But we ask our clients a lot of questions and we fill those out accordingly. So the best way to do it is to have somebody professional do it and do it right for you, because if they do it right, they're gonna ask you questions of what do you want and how do you want things done at certain places. Now, I also saw another one that this is one that, I'll be honest, disturbs me as a lawyer, is that a lot of places require people to have an out-of-hospital DNR. And I saw that there was a link somebody put up to get that form. And again, it is a state form that is provided. I hate that, because the fact that that's required means that the person has to know how to fill it out right. And I can't tell you how many times I've seen those filled out wrong. I've had people bring them into me and say, okay, I've already got this. And I look at it and I said, okay, so you want to do this, this, and this, and this is the things that you're wanting. And they're like, no, that's not what I want at all. Well, that's how you filled it out. And that's how you answered the questions that it has. And so that requires complications. And it's almost, in my opinion, medical professionals trying to practice law because they're requiring this form that they're hoping the people, they're making the people fill them out, and they're hoping they fill them out correctly.
Okay, here's a
Rebecca,
good
just so
question.
you know, Rebecca has raised her hand and I've let her come in.
Oh, okay.
Just so you know,
Okay.
I'm sorry.
Hi, everyone. My name's Rebecca. I'm a social worker with Legal Aid of Northwest Texas here in Lubbock. And I'm actually filling out an advance directive for myself. And I did want to comment, it is kind of vague because I'm looking at the life-sustaining treatments. And one of the questions is, if I am unconscious, in a coma, or in a vegetative state, and there's little or no chance of recovery, you know, where is it where we can put that we do want life-sustaining treatments, but not under any of these circumstances? It's not clear. It's either yes or no, or I'm not sure. It would depend on the circumstance. Well, what circumstances are there? Like, I do want life-sustaining, but I don't want to be kept alive in a vegetative state or any of the other options. So it is kind of vague when it comes to answering some of these questions. So how do I say that I do want life-sustaining treatments, but not when I'm not going to be able to be left alive? You know what I'm saying? Does that make sense?
Yeah, that makes perfect sense. One of the, you're hitting right on the point that I talk to people about all the time. Everybody wants to save money. Everybody wants to simplify things. And we are living in a world right now of everybody can get on Zoom or Google and do it yourself. This is one of the worst areas you could try to do that in, is any in legal documents, because these legal documents don't allow you to do that. They're very generic. They're one size fits all, and that's not good. That's why my firm and firms like me, customize things to every client we deal with, because no two clients are the same. What you want is not the same as what I want, what anybody else wants. So, I always tell people, please spend the money to do it right. Because if you don't do it right, you're not going to know it's not right until what hits the fan, and it's too late. And I get that all the time. You need these forms filled out. I had a gentleman call me one time and he said, I can do it cheaper on the internet. And I said, yes, sir, you sure can. And he said, you can't tell me that you don't use forms to fill out your documents. And I said, no, sir, I'm not about to tell you I don't use forms, because if I had to rewrite every single document I did for every client, I would be here forever. I couldn't do it. So yes, I use forms. We have legal forms that we use as templates. And I said, but I know how to fill these forms out. Do you? And he paused for a minute and he said, well, when can I come see you? I said, that's really what it comes down to. A lot of these forms, people are trying to fill them out and they don't know what they're doing. And it causes major, major problems in this area.
Okay, here's another one. Nancy would like to know, what is an agent of record and what access does it give you regarding medical information?
I'm not really sure what exactly you're asking, except that an agent is the person that's been appointed by somebody to make decisions. So for instance, on a statutory durable power of attorney or financial power of attorney, your agent of record is the person you've designated to make financial decisions for you and to take care of your finances if you can't take care of them yourself. The same thing on a medical power of attorney. A medical power of attorney agent is the person I've appointed to make medical decisions for me if I can't make them myself. And so your agent of record, I'm guessing, is whoever they've designated at your doctor's office or the hospital or wherever, this person has said, I appoint my spouse, I appoint my daughter, I appoint my mom to make these decisions for me.
Okay, then Beatrice wants to know, how many doctors does it take to certify that the person is beyond hope?
Typically 2. That's a decision of the medical facility, but typically it's two medical professionals that have to make that determination. We see that all the time with how many doctors does it take to determine when a person is mentally incompetent, doesn't have the mental competency to make decisions, and it's two. The legal requirement is needs to be two doctors.
I'm going to read this because I don't quite understand it. Jenny says, we have NPs who do home visits, assist with completing ACP forms. Are you saying the medical professionals should allow attorneys to assist with this rather than medical professionals?
Most definitely, yes.
All right. Okay, let me see over here. Well, then this is going to go back to the ethical thing that we talked about before. As a dialysis social worker with a caseload cap of 125, what are the ethical options for the social worker over the census and given financial incentive to advocate that the money promotes burnout and turnover? Teresa, this is really for you because we kind of discussed this before, but this is another person.
Yeah, I mean, that becomes a huge issue in all medical areas, is incentives versus your ethical responsibility. and we all need to make a living, we all need to pay our bills, and we all want to make more money no matter what we're making. And that becomes huge issues of, okay, do I stay within this? And sometimes it becomes a job, keeping your job issue, because there are some bosses, some employers that would rather you do unethical things and make them more money than do the right thing. And that's where I think a lot of burnout happens. I think we have a lot of medical staff that quit because they just say, I can't do that. I refuse to do what they're asking me to do because it's not the right thing to do. I've had issues in the legal field like that. I had some serious ethical dilemmas when I was a litigator of representing clients that I didn't believe in, that what they wanted me to do was outside of what I was willing to do. And I either fired them as a client or I ultimately quit doing litigation just because I got tired of having to deal with that all the time. But yes, that's a very common thing that comes up because money talks, and businesses are in the business of making money, and it sometimes clouds the right thing to do.
All right, I see this from this comment or question from about 3 people. How do we tell clients who have no money to spend on getting legal assistance for advance directives? That would be telling them to choose between housing, food, utilities, cancer treatment, or these forms. Oftentimes they come to us because they cannot afford to cover their basic needs now. Are there any services with legal guidance that can assist?
Yes.
I would assume legal aid does.
Yes, there's almost every area and every state has legal aid. There in our area, the DFW area, there's the North Texas North Texas legal aid. There was legal aid. There was a Project LULAC and places like that when I was out in El Paso. I work with attorneys all over the United States, and there is always places for low income individuals, and a lot of those times they will provide them with these documents. When I was in El Paso, we actually one of the probate courts would put on a will clinic, and we would actually volunteer. Some of the attorneys would volunteer their time to go out on a Saturday, and we would provide legal documents for people in low income areas. So yes, there are options out there. Now, I'll be honest, the reality is lower income people don't get the same quality that people that can afford it do. We see that in, public defenders in criminal cases, and you see it in this area too. But at least there's something out there that they can go to and not have to to have to make the decision of feeding their family or doing documents.
Okay, this topic keeps going back, and now they're arguing amongst themselves whether they need attorneys or not. Okay, back to one of the other issues that Fred talked about. You know, it's unfortunate, and you wouldn't think this. However, those of you that are LPCs, I know that it happens. I know that it happens that a client, for whatever reason, the therapist gets involved with the client. And this happened recently to someone that I know. And he wasn't the person that she got involved with, but it happened to someone else. And when it got, I don't know, he didn't report it. He knew it, but he didn't report it. And it eventually caught up to the person and they were let go. And it's unfortunate because they were a clinical director. It was a bad situation, but it must be very difficult because but the key takeaway from that is you're an LPC in particular, you're so involved with the person's psyche, I would think, that it becomes, you can see why they would become attached to you. That you could see, but it must be very difficult to draw the line, but there's got to be a clear line there, because otherwise that person then is at more jeopardy. Anyway, that is an issue that came up in a realm that I'm in. And then also another issue was another LPC, and this was an LCDC that showed an incredibly inappropriate picture to some of the clients, thinking that it was funny. And it was a picture on the internet. It wasn't something that he did, but it was very inappropriate. And because of that, it was kind of deemed sexual harassment, and the person was fired. So sometimes I think it must be difficult. That's the reason I asked if anybody was here from a rehab. When you're dealing with a bunch of guys, or it could be women, I guess, and you're joking and laughing with them, and you're no telling what they're telling you. And it could be, but you have to draw the line somewhere, because in that case, that person got let go too. So there are things that are coming up all around us, and we're hearing this secondhand, but there's all kinds of things that are coming up around us that are ethical dilemmas that are being faced out there that you would not think. You would think, well, that's common sense. Of course you wouldn't do that. But somehow when you're in certain dynamic groups, it just kind of gets a gray area.
Well, when it comes to saying things, I've always been told that if you wouldn't say it to your priest or your preacher or somebody in the faith that you're in, it probably shouldn't be said at work, and it probably shouldn't be said to patients or clients or anybody like that. We just get comfortable. We get comfortable around our coworkers, or get comfortable around the people we work, and sometimes we let our guard down and we say things we shouldn't say. So that's a good way to think about it, is if you wouldn't say it to a religious professional, you probably shouldn't say it at work.
Here's a one that says, I have a client that has cancer, MS, and lupus. Oh my God. She has a counselor she goes to weekly, but at this point has stopped. The counselor just wanted to talk about my client's ex-husband and not hear any other issues she's dealing with. She also uses the F-bomb frequently, even though my client oh my gosh, requested her not to. I'm considering reporting her to the licensure board.
I think that's a good idea.
Wow.
That's very unprofessional.
Oh, this is a good one, Fred. How do you suggest handling expression of political views at work?
What's the saying? You don't talk about politics, or no, and that's become a big issue at now. And there's not any legal issue that I know of. It's not considered harassment. It's not considered inappropriate. I mean, as far as legally, that's a hard area right now, but the rule of thumb is just don't do it. And if somebody's insistent on doing it, just get away from them. Everybody has, opinions are like certain body parts. So we all have them and they're useless. So it just becomes a big issue. I found this a lot, these kind of things. Part of my litigation time, I was an employment lawyer. I did some plaintiffs work representing people wanting to sue their employer for wrongful termination or things like that. And I would get people that would come in all the time and I'd tell them, well, that's inappropriate and it's not, I don't think it's something that should be allowed, but it's not illegal. And there's a big difference between inappropriate and unfair and illegal. And there's a lot of things that happen on the workplace that are in that gray area.
Well, I would agree. And then it says, Sherry says it just makes her look at different people differently that talk politics. Yes, because it makes you feel like they're just they're baiting you, trying to get you to say something. You're just like, nope, well, not going to go there.
What gets me is, the reality is if I'm Republican, no Democrat's going to talk me into being Democrat. And if I'm Democrat, no Republican's going to talk me into being, so why do people do that is beyond me. We all have our own feelings and our own beliefs and our own ways, and nobody arguing their side is going to convince me otherwise. And I think that's true with pretty much everybody.
All right. And this is a good, Machanta says, politics, parenting, religion are areas that we need to stay away from. Yeah. Yep.
Save them for Thanksgiving.
Yeah. Oh, because that works so well. Yes. Oh, anyway. All right. Are there any, I don't see any other
comments. Some people are asking about forms, and I'm not sure what forms you're referring to, but if you're referring to the PowerPoint slides and the handout, those will go out to everyone in the follow-up email. If you're referring to forms to fill out for these things, I obviously don't have those. I'm not going to send those out. You might get them from somebody else. They might send them to you, but that's up to them. But do you want to go ahead, Sheila, before we end up against
Sure.
That's great. Go ahead and go over the CUs.
Sure. And I think these possibly are the forms, Marty, that they're talking about.
Yeah, oh, sure. Okay.
And that's because you haven't gotten them because we haven't sent them out.
Yeah, those will go
I
out in a
haven't even
follow-up
sent them to
email.
Marty, so he doesn't have.
And those will either go out late today or tomorrow in a follow-up email to you all. These three
Okay.
forms
Yes.
and the link to the PowerPoint slide, the handouts, and our Google survey. But go ahead. Sure.
Okay.
Sheila.
These are the three forms that Marty will send you out. I need, the disclosure statement is just for your records. Please, please fill them out. I have had on occasion, a couple of people send them blank and I'm like, no, that won't work. I do need them filled out. But anyway, please fill them out and send them back to me and I will be happy to send you your certificate. And this is for 1.5 hours. Okay. This is not for 1 hour. It's for 1.5 hours, just so you know.
Great. So in order to get the CUs, you must complete those forms and get them to Sheila and they provide the CUs. But we're also asking you to fill out our Google survey, which is the North Central Texas Area Agency on Aging. That Google survey should pop up as you close out of today's webinar. If it doesn't for you because of a block or some reason, it will also be included in the follow-up email. I realize there's a lot of people giving information in the chat, and I don't know, just so you know, obviously that's just people that have signed up for this webinar. I don't know these people. I just don't want to be I want you to understand that, that's just fellow workers giving you their information, and I'm not you can take that for what it's worth, but I just want to make sure I point that out, that I don't know any of the people that are giving you advice other than the people from Haiman+Hogue, the other people that are giving advice on the chat.
You know, I just want to finish up, Marty, what I emphasized earlier, and I'm not, you know, I'm saying this as a public service. You know, people that don't do these documents right and don't take the time to spend the money to have a professional do it, make me and attorneys like me a lot of money, because we make a lot more money cleaning up messes than we do doing it right the first time. I also hate seeing situations where families come to us and they think they're protected. They think they've done things, and now it's too late. Now mom's in a memory care, or dad is now in the hospital, and they've realized they don't have what they need. And I have to tell them it's too late. I can't help you now. I can't do anything now because of the mental capacity of the person or whatever. So please just, you know, take the time to talk to somebody that does this right and do it right. You know, what it's kind of that saying, why is there never time and money to do it right the first time, but there's always time and money to do it over? Just do it right, please.
I will also include the link, which I put in the chat earlier, for Legal Aid of Northwest Texas. And just so you know, that's just the primary legal aid agency in the area that's our primary service area. I know there's people joining us from all over the country. I know there are legal aid organizations that cover that I'm pretty sure blanket the entire United States, depending on where you are. But I've put the link to ours. I'll also put that in the follow-up email, but that link has the area of services that they provide, and it does include what we've talked about today. I read through it as before I included the link in the chat, but if you'll see that link, and I'll include it in the follow-up email as well. Thank you, thank you, thank you. Fred and Sheila, thank you so very much. We certainly appreciate it. Thank you all for joining us today. If you have any other questions, you're more than welcome to send them to me. Obviously, you know, they can't give specific legal advice to people that aren't their clients, but we'll try to get general questions answered for you if you want to send them to me. And then look forward to that follow-up email tomorrow with the forms you need for the for your CEUs and the other links that we've talked about. You all have a wonderful day.